Hello, my name is Dr. Yuka Manabe. I'm a professor here at Johns Hopkins and an expert in COVID-19 diagnostics. If you've been exposed to a person with COVID-19 and have been in close contact, meaning you're within 6 feet or for longer than 15 minutes, you should test for COVID-19. The best time is to test 2 to 3 days after that person has tested positive, or if you have symptoms. Symptoms of COVID-19 include fever, loss of taste or smell, shortness of breath, or cough. You do not need to have all of these symptoms to test. If you have any of these symptoms, you should consider testing. If you have had an exposure to someone with COVID-19 or live in the same household as someone with COVID-19 and have not been able to effectively isolate, you should test again. One negative test does not mean that you do not have COVID-19. You should continue to double mask if possible or wear a very high filtration N95 mask, and you should avoid going out into crowded spaces during this pandemic. If at all possible, when one person in the household has COVID-19, all should try to isolate. Certainly the person who's been diagnosed with COVID-19 should stay alone in a separate space if possible and also use their own bathroom. If that's not possible, then they should wipe down the bathroom after using the bathroom before another uninfected person uses that space. You should try to wear masks within your household until the 14-day quarantine period is over. It is important to consider what your risk for COVID-19 was. If you live in a household with another person with COVID-19, you should be self-isolating. If you are without symptoms and you tested just to see if you have COVID-19, then you may be okay to go out if you are double masked and try to stay socially distanced from others. If you have an antibody test that is positive for COVID-19, it means that you have been infected with COVID-19 unless you have been vaccinated, in which case an antibody test could also be positive. Whenever you go out, you should still wear a mask because having a positive antibody test does not prevent you from having a risk of being reinfected.